Hello everyone. A pleasant morning to one and all. It's a bright and sunny day here in Ahalya. Today, the 16th of October, which happens to be a Sunday, is a special day. Well, what's so special? It's World Anaesthesia Day today. It was on this day in the year 1846 that something path breaking and something unimaginable was achieved. So I thought, why not make use of this opportunity to share and educate you all regarding the history and legacy behind the specialty which we call anesthesia today. On 16th of October 1846, an American dentist cum physician named William Thomas Green Morton first publicly demonstrated the anesthetic properties of ether in a surgical amphitheater at Boston, Massachusetts. The surgeon, Dr. John Warren, proceeded to remove a tumor from the neck of a patient named Gilbert Abbott, who remained unconscious and pain-free during the entire procedure. After the procedure, the patient woke up and claimed that he never felt any kind of pain. The bewildered onlookers were totally bemused. They thought this was some kind of a magic trick. It was totally unimaginable in those days. But the medical fraternity who were present in the amphitheater instantly knew that something path breaking and something unimaginable was achieved on that day. They believed that mankind had control over pain. It is to commemorate this stupendous achievement that this day, the 16th of October, is celebrated as World Anesthesia Day throughout the world. Now, the question that comes to everybody's mind is, what were people doing before this and how did this revolutionize the practice of surgery? Well, there were times when the patients would just be pinned down by 4 or 5 volunteers and the surgeon would proceed to incise the patient without providing any kind of pain relief. As civilizations developed, people thought this was barbaric and they thought, why not give a blow to his head or throttle his neck in such a way that both the carotids were compressed, and that led to unconsciousness. They were partly able to attain this level of unconsciousness, but the problem was most of the patients never woke up after surgery. Then during the Middle Ages, the use of various alcoholic beverages came into practice. Then people started using several different proportions of herbal medications and made concoctions using 3 or 4 herbal medicines, and they were used in various proportions, which mainly included opium, mandrake leaves and roots, datura, and this to some extent achieved pain relief during surgery. In the Arab world, soporiform sponges were being used. Sponges were dipped in all these herbal concoctions, and the fumes from these sponges were allowed to pass by the patient's nose. And as the patients inhaled them, they felt some kind of dizziness, pain relief, and unconsciousness. In Japan, a surgeon named Dr. Seishu Hanoka came up with a new kind of herbal concoction, which he called it as Mafut Susan. This drug was very effective in providing effective pain relief to patients. And mind you, this happened around 50 years before ether was being demonstrated publicly. And between the arrival of Mafut Susan and the demonstration of ether, there were attempts made to study nitrous oxide as a potential anesthetic agent. Even few dentists proceeded to do tooth extraction with nitrous anesthesia. Now, just immediately after ether was gaining popularity as a inhaled anesthetic, chloroform soon came into existence. And ether and chloroform continued to be the mainstay of anesthesia for the next 100 years, till the arrival of halogenated hydrocarbons, which were thought to be more stable and more potent when compared to ether and chloroform. The first one was halothane. That paved the way for several other better inhaled anesthetics, which includes methoxyflurane, enflurane, isoflurane, desflurane, sevoflurane, and the most recently developed xenon. All this while several other techniques were developed, which included regional anesthesia using cocaine, where ophthalmologist Dr. Carl Kohler used cocaine to do surgeries on the eye. This led to the usage of cocaine in the intrathecal space, and first spinal anesthetic came into practice around 1900s, which soon led the way to the development of epidural anesthesia. And by 1930s, the first intravenous anesthetic, which was thiopentone, was being developed, which further led to the way other IV anesthetics like ketamine, etomidate came into existence. Simultaneously, newer gadgets, newer equipments to deliver anesthetic vapors were being developed world over, and newer methods of monitoring the patients were being developed. All this were combined beautifully, blended seamlessly, and woven into a fine fabric which we call as anesthesia today. The practice of anesthesia today has no remote resemblance to what was being practiced 150 years ago. We have come a long way. The advent of technology, the use of ultrasound guidance, infrared guidance, and artificial intelligence has revolutionized the way anesthesia is being practiced today. If there is one specialty in medicine that has undergone major transformations over and over and come up with new solutions to every different problem, that is anesthesiology. If there is one specialty in medicine that has intrigue attached to it and an air of mysticism about it, that is anesthesiology. Anesthesia is more like an art form in medicine. The practice of anesthesiology is not a child's play. The pioneering surgical efforts in all these years were made possible with the developments that were happening in anesthesia. The surgeon no longer needed to worry about the patient because an entire specialty was doing its best to ensure that the patients were safe when the surgeon was exhibiting his skills. Now, anesthesiology is not a caged bird anymore. It has spread its wings, and so many subspecialties have come up to keep up with the demands of modern world. So, how is the practice of anesthesiology in Ahalya Hospital? Well, we offer our anesthesia services, pain services, critical care services, and so on to all three hospitals in our campus: the Diabetes Hospital, Eye Hospital, and the Women and Children Hospital, 24/7. So we are extremely happy to be a part of Ahalya, and I would like to take this occasion to thank our wonderful surgeons and beloved colleagues, the podiatry team at ADH, which comprises of Dr. Sri Ganesh, our orthopedic surgeon, Dr. Roshan Rodney, our vascular surgeon, Dr. Jayanti Nathan, our plastic surgeon, and Dr. Muruganand, our general and laparoscopic surgeon. It's a pleasure working with you all, sir. And coming to Eye Hospital, I'm a big fan of the clinical work done by Dr. Rajkumar and Dr. Sajeev. They have been wonderful friends. And to come to Avach, we have high regards for all the gynecologists and the pediatric surgeon who are working in Avach. It's been a pleasure working with each one of you. And not to forget about our physicians, Dr. Ramalingam and Dr. Shantakumar, and also our super specialists, Dr. Prem and Dr. Shahin, who play an integral role when it comes to taking care of patients in the critical care unit. We rely on inputs and guidance from you, sir. Now, we are up to date with all the modern equipments and sophistication at Ahalya. We have successful teaching programs running in the department. We have our first postgraduate who is getting trained. We have even anesthesia technician students, 2 batches presently, who are getting training in the anesthesia related technical aspects. So overall, this is a very enriching experience which I thought has to be shared with one and all. Thank you.